Hello dear learners. Today the point of discussion is classification of antipsychotic agents. So you must know about what is psychosis. Psychosis occurs because of imbalance of dopaminergic functions. So these antipsychotic drugs or agents are work by altering the effect of certain chemicals in the brain like dopamine, serotonin, acetylcholine, noradrenaline. These chemicals have effect of changing behavior. So in that, because of imbalance of dopaminergic functions, generally the level of dopamine get increased, and these antipsychotic agents which acts on dopaminergic receptor and which try to reduce that dopaminergic functions. So let's begin with the classification of these antipsychotic agents. But before that, few important points regarding these antipsychotic agents. Antipsychotic drugs are used to treat psychosis. Psychosis, which is a severe mental illness in which people lose touch with reality, like schizophrenia. Antipsychotics are drugs that have a specific sedative effect and improve the attitude and calm the behavior of psychotic patients. These drugs cause emotional calmness and are extremely effective for treating patients with severe and chronic symptoms. These antipsychotics are not CNS depressants. On long-term use, they do not cause dependence and addictions. So this is the important point regarding the antipsychotic agents. Now moving with the classification of antipsychotic agents. We broadly classified these antipsychotic agents into typical or classical antipsychotic agents which mainly acts on dopaminergic receptor, whereas second broad class is atypical antipsychotic agents. So these agents act on dopaminergic as well as serotonin receptors. So here we discuss about the chemical classification of these antipsychotic agents. So first class is about typical or classical antipsychotic agents. First one is phenothiazine derivatives. Here is the phenothiazine ring and here is the R, means these are depending upon the presence of this side chain to this phenothiazine ring. There are the further classification of these phenothiazine derivatives. So first class is propyl dialkyl amine side chain. So here the propyl dialkyl amine side chain which are present, examples are promazine, chlorpromazine, triflupromazine. Second one is presence of a ethyl piperidine side chain. Example is thioridazine, mesoridazine. Third one is having propyl piperazine side chain. Examples are prochlorperazine, trifluperazine, thiethylperazine, perfenazine, fluphenazine, acetophenazine and carfenazine. So all these are the different phenothiazine derivatives depending upon the side chain which are attached to phenothiazine ring or moiety. Second class is thiothiazine derivatives. Examples are thiothiazine, chlorthiazine, flupenthiazole. Next one is butyrophenone derivatives. Examples are haloperidol, droperidol, trifluperidol. Next one is diphenylbutylpiperidines. Examples are pimozide. Next one is dibenzoxazepine. Example loxapine. And next one is the dihydroindole. Example is molidone. So all these are the chemical classes under this typical or classical antipsychotic agents, and all these drugs are specially act on dopamine receptor. Whereas the second class is atypical antipsychotic agents. We further divide these as D4 receptor antagonists, example clozapine, mix D2 and 5-HT2A antagonists, example risperidone, ziprasidone, quetiapine, ceritindole, olanzapine, iloperidone. So all these are about the classification of antipsychotic agents. Hope all of you getting this. Thank you and happy learning.